Hello everyone, in today's lecture we will talk about laryngitis in children. So laryngitis is an inflammation of the larynx, the voice box, and this will lead to hoarseness, barking cough, and stridor. It can be infectious or non-infectious. The non-infectious example are overuse, like when someone talks too much, the next day his voice will sound like a horse, you know that. Allergies and gastroesophageal reflux disease. So, about the infectious etiologies, we will have viral or bacterial. Viral are 90% of the cases. We can have parainfluenza virus, influenza A and B, rhinovirus, adenovirus, and respiratory syncytial virus or coronavirus. These are the viruses that can cause it. The bacterial are Streptococcus pyogenes, Staph aureus, Corynebacterium diphtheriae, and Haemophilus influenza type B. So the most diphtheria laryngitis is life-threatening. This one is important. The pathogenesis. So first of all, the virus will enter the laryngeal mucosa to inflammation and swelling of the vocal cords. Then we will have a mucosal edema, and the mucosal production will increase. This will narrow the airway. We will have vibration of the swollen vocal cord, and this will lead to the hoarseness and the barking cough. Then we'll have a severe swelling and we'll get obstruction, and this will lead to the stridor, the high pitched sound on inspiration, and it can extend to the trachea and the bronchi, and we will have laryngotracheobronchitis crop. The clinical symptoms. So in the mild laryngitis, we will have hoarseness, which is a change in the voice, sore throat, a dry cough, later will be productive, and low-grade fever. So the only difference from bronchitis is that we will have a hoarseness of the voice. The moderate to severe laryngitis, we will have crop-like symptoms. We'll have a barking cough, the seal-like cough, inspiratory stridor, it worsens at night, and we have a mild fever and dyspnea, difficulty of breathing. In the severe cases, we will have severe stridor at rest, not even doing any activity, and he will have a stridor, and retractions, nasal flaring, cyanosis because of the hypoxia, and toxic appearance. Yes. So, first of all, let's discover the hoarseness of the voice. So, the voice will be scratchy or husky. I'm sure everyone knows what is the hoarseness of the voice. Let me give you an example. When you maybe talk too much or something, the next day you will wake up, or shout maybe, the next day you will wake up and your voice is changed. Or sometimes we know when you're sick and people tell you your voice is changed. But I found this video. Let's watch it. It kind of demonstrates hoarseness.
What a brew, love.
Early symptoms of lung cancer are subtle and easy to ignore or dismiss as something else. But if you've noticed your voice is hoarse or croaky and there's no real reason for it, you need to contact your GP practice.
Do you want a coffee, love?
So it's actually a symptom also of a lung cancer. So, but it's also laryngitis. So we saw the old man. He had some difficulty speaking, and his voice is become like deeper, maybe to say scratchy, husky. Then the barking cough. It's also known as crop. Sorry, it's an infection of the upper airway. The voice will become thorough, and we will have a hard breathing. So let's hear the barking cough. That's such an amazing video. We saw the barking cough, the noisy breathing, and finally the hoarseness of the voice. So that cancels the need of the previous video. But let's see it again, cause wow. So we saw the barking cough. Let's see another example. So this is the barking cough. Then we will have an inspiratory stridor. Let's watch this.
Nah, he don't.
Inspiratory. So if you see, this sound is coming out after he's trying to breathe, like taking the air in. This is so hard to watch, but yes, we need to learn. So I think these videos were amazing. We saw in the inspiratory study when they are trying to breathe in, we will have this voice. Then the physical examination findings, we mentioned that hoarse voice, barking cough, stridor. We will have no drooling. We will have drooling in epiglottitis, and yes, this we mentioned already. This laboratory test. The CBC will have mild leukocytosis if viral, high YPC if bacterial. We'll have neutrophils, neutrophilia. CPR, procalcitonin, low in viral, high in bacterial. Throat swab if bacterial suspected. Yes, we should do it if we suspect bacterial because diphtheria is life threatening. Instrumental studies. Neck X-ray is so important because we will have the steeple sign, which is narrowed subglottic area, and this is what caused the barking cough. In the case of recurrent case, we'll do a laryngoscopy. We'll see a swollen right vocal cords and pus on the membranes in case of bacterial laryngitis. I saw a video, but I didn't add it, unfortunately, so just search it. It's really interesting. I will do a pulse oximetry to check the oxygen saturation. If it's less than 92, we will need an oxygen support. So this is the stable sign. If we see, look at the narrowing. We will have narrowed subglottic area. So this is the narrowing. I hope it's clear in the video. This is another stable sign, narrowing. Now let's speak about the treatment. First of all, we just do a supportive care. We will give a steam inhalation because it will help with the symptoms and the cough. Just maybe give the child a shower, a little bit hot shower with the steam, or just put a pot of water on some heat and let him inhale it. Hydration, oral or IV. If his oxygen saturation is less than 92, we'll give an oxygen therapy. For the medications, we will start with the corticosteroids, dexamethasone, for example, first line of treatment to reduce the swelling. If he have a severe stridor, we give him a epinephrine, and actually that's all. We should avoid antibiotics if he didn't have a bacterial infection. Also, we avoid the antihistamines because its dry secretions are worsen the symptoms. And cough suppressants, we avoid them because they will reduce the clearance of the mucus. And generally, cough suppressants usually are not safe for the children less than 6 years. Yes, like younger than 6 years. And we should admit him to the hospital if the stridor didn't. If you have severe stridor at rest, cyanosis or respiratory distress symptoms, and no improvement after giving him the steroids and the epinephrine. For the prognosis, most cases will resolve in 5 to 7 days. Corp symptoms usually improve within 48 hours. We should be aware of the bacterial laryngitis, diphtheria, and Haemophilus influenza B because it can be fatal if the recurrence occurred a lot. So we should evaluate GERD and allergies. That's actually all for today, for today's lecture. I hope you found it useful. Thank you so much for watching and have a great day. Goodbye.